Hello, everyone. This is Dr. Rob from Pain Free for Life. Welcome to our Monday 10-minute training. In these sessions, I try to cram a few tips and tricks into a relatively short, easy to digest video. I try to keep it under 10 minutes, though sometimes I'm guilty of going over. Today, I want to talk about post-surgical healing. So we try to avoid surgery where we can, right? I mean, obviously, it's not something we should just be opting into all the time. But because surgery, whether it's laparoscopic or through a large incision, will create scar tissue, which can contribute to further breakdown within the body. But we're realists here at Pain Free for Life. We understand that sometimes surgery is necessary. We can want to avoid something as much as we want, but ultimately, sometimes surgery is necessary and life-saving. I myself have had both my tonsils and my appendix out due to severe infections. My wife has had a C-section, etc., right? Surgery happens. Now, in these cases, when surgery does have to happen, we want to take a proactive approach to enhance the healing process and reduce complications post-surgery. There are general treatment rules that we must adhere to when we're working post-surgically on ourselves or on other people. So, first off, direct microcurrent. Direct microcurrent is always going to be better, in my opinion, than PEMFs and Scalar. So if possible, you'll want to work around the individual area with microcurrent. So if you had surgery on your arm, you would want to work around the incision directly with microcurrent if you can. Now, if there's a dressing in the way, that can be a problem. And in that case, you're going to want to work the mirror part of the body. Did a training a little while ago in similar vein to this, where we talked about the good limb, right? The good side of the body. Now, being able to treat this side, even though I didn't have surgery here, in the exact same place that I had surgery will affect the side I had surgery. So you can do this to get around the issues with dressings and things like that. There is also other options, right? PEMF, such as the Chi wave or the ViaQi, you can work directly on the incision that way through the wound dressing. So by taking the ViaQi here, for example, I would be able to put this over the top of wound dressing and it would go through. It would actually pass right through my arm as well. So you can deliver the frequencies you need to encourage healing, but it's still also better if you can do even a couple of minutes of direct microcurrent before you switch over. It's going to be much better that way. Now, scalar waves, the scalar Chi, I'm doing a big teaching in this group on scalar on Thursday, actually. And scalar is always excellent for pretty much everything for enhancing healing. So you should always use the scalar waves if you have them on hand. So you can finish the surgery and you can immediately start treating with scalar at 7 to 12 hertz and max power. It's going to be very, very beneficial. A common question we get with surgery is metal implants. So can we treat over any replaced limbs or areas with screws? And the answer is yes. So there's no need to worry about that. You can treat just fine through with metal implants. So there's no issues there. Now, when it comes to the actual treatment, I mean, that's probably what a lot of people are here for. What would I recommend doing? So first, I want to really focus on a 4-step healing approach for post-surgical treatments. Number 1 is dealing with the drugs and the sedation side effects, because those are going to linger and you want to get rid of them as soon as you can. You want to help your body detox. Number 2 is anti-inflammatory. Number 3 is new blood flow and regeneration. And number 4 is scar tissue. Now, this may surprise some of you because normally we talk about scar tissue being the first rule of microcurrent, right? It's the first thing we go to. But remember that at this stage, the scar tissue has not fully developed. It will develop. But post-surgically following this treatment, you're probably going to notice that the scar is very minimal. You're not really going to have a big scar. And this is because in following this protocol, you're encouraging better healing of the tissue. This is going to result in a reduction in scar tissue, but it's still important to treat. You just have to wait to the point where it would have actually developed some level of scar tissue. And so I like to give that a couple of weeks, but we'll talk about that in a second here. All right. So let's get to the actual treatments here. What would I actually recommend you do? And again, we're keeping this in a nutshell, nice and short, right? So we're already halfway through our time. I hope to be able to wrap this up really soon for you. So when you're doing your treatments, first I mentioned dealing with the drugs and the sedation side effects. So I really like to treat the liver using 90 hertz if you have the Pro device, or 77 hertz for the other devices. Now, for those of you who don't know, your liver is underneath your right side pectoral area, right? So this is my right side. So here's your pectoral area, your breast area. Right underneath there is where your liver is. And it kind of stretches along a bit, thinning out there, and it goes down on the side here. So what you would do is you would take your device, you would set it to 77 hertz or 90 hertz, and you would paint over the area. Now, chances are, even this is going to be good even if the surgery isn't here, right? If you had surgery on your neck or your brain or anywhere else, you need to deal with the sedation and the drug side effects, the painkillers they'll put you on and all of those things. So you can paint over this area. You'll notice sticky spots. We've done a video on active zones as well. I recommend, again, you look back through the past videos to find that one. But you want to get rid of the active zones by painting over it. Once you've done that, you're going to be doing that daily, and that's going to really help to reduce the effects of the drugs and the sedation. So number 2 is to work on anti-inflammatory. So this is for pain, right? This is for inflammation, and this can hinder healing. While it's also important for acute injuries, we want to try and manage the pain. There's going to be a lot of inflammation after a surgery. So this will help to manage the pain, and then it will also help to speed the healing process. Once that inflammation is down, we can start to actually heal the body. So anything above 100 hertz works here. I actually really like 121 hertz for holding it in place. And then depending on the device, if I'm going to be moving it around the incision area, I'm going to be using 350 hertz modulate or blue stimulation, depending on what I have at hand. So as for new blood flow, which is our next step, this is achieved by specific modes in the device. Typically, though, you just need a lot of pulses to be able to actually generate the blood flow, encourage the blood flow. So some modes are better at this than others. Vaso in the Pro device is the king of blood flow. Highly recommend using Vaso if you have access to it. But if you don't, fMRSI is really good, and so is blue stimulation. These things will encourage new blood flow. They'll encourage the formation of new blood vessels. So you'll get more blood flow to the area, and the blood is going to be able to help rebuild the damaged area. You also want to be doing the 90 or 77 hertz here at this stage over the area to actually repair the soft tissue. Now that's important if you want to actually reduce the possibility of scarring. But again, the tissue that's being cut through is going to be the soft tissue that you got to repair. Now, as for the scar tissue, this one's pretty simple. I've done a full training again on scar tissue before, but you're going to need to use 77 hertz to tackle the scarring. That's blue relax in the Pro mode. This should be started about 2 weeks post-surgery. I think before that, you're just jumping the gun, and there's no need to do that. You can be doing all the other parts first, but you're going to want to spend probably a week doing daily treatments with 77 hertz to deal with the scarring. You're going to be able to neutralize the scar tissue in one go, but you want to be able to actually reduce the formation of it as well. And so doing a week's worth of treatments will be very good there. So we did it. We made it in under 10 minutes. In a nutshell, that is post-surgical therapy with microcurrent. I hope that you found this information helpful, but if you have any questions at all, please don't hesitate to let me know in the comments below. If you enjoyed the video, if you found it useful, I'd love to hear that as well. So I'll see you next week for another Monday 10-minute training, and we will continue to learn more about microcurrent and all that it can do. Take care.